Stephen Rubendall. I'm a family physician. I work here at the local Erlanger Peachtree primary care. Primary care in general has to be patient-focused and the patient's at the center. So I think that you want to go somewhere where you feel like you are being listened to, and I feel like you can tell that doctor openly everything that you feel like you can comfortably, feel like that when you have a problem, the practice is responsive, and that they're well trained and know how to handle these problems. You have to have all of that. And I think that people gravitate towards that. I call people on the phone and people are like, oh my gosh, you're calling me? I was like, well, yeah, it's a lot easier way than playing telephone by sending this to the nurse who sends it to somebody else to call you. So I still try to distill what I do down to what people envision probably from the past about what primary care is supposed to be or your family doctor is supposed to be. And it really makes it great when you have a family member come in who kind of is testing you out, and then the next thing you know, you're seeing their husband, and the next thing you know, you're seeing their daughter, and there's a really kind of a jolt about that. And I think that most people want to have a family environment where they know all the staff, and as you do with any kind of thing that you do, that relationship's everything. You're the first touch with the healthcare system. It needs to be good. Erlanger is very supportive of us building these primary care practices in this area. I think the focus always needs to be on this foundation of primary care, because everything else kind of spills and grows from that. And you can see that. And Erlanger's committing to having cardiologists come up here and trying to get all the specialty services we need locally. When you can say, hey, we've got our Erlanger cardiologist who's going to be in this office where you see me already, coming this Friday, would you be interested in seeing them? They're like, of course. I put up a mailbox at my house, and the rumor, this is kind of a small town, and so next thing I knew, I was checking my mail and there were cookies in there, and then there was a loaf of bread in there one day, and the little nice notes from people saying, we're so happy that you're here, we've been waiting for more primary care doctors for a long time. So really, it's been kind of overwhelming, and kind of what I would expect, coming to an area that for a long time has been trying to just kind of make do with whoever's here, and now we're kind of making a concerted effort to meet the need.